All right, thank you, Chad. We'll check in with you in 45 minutes. Well, in many places, coronavirus cases are once again on the rise. And now a big question facing the Centers for Disease Control and Prevention is how to regain public trust following years of public debate over the agency's guidance.
Our Washington reporter Joe St. George taking a look at what the CDC is trying to do right now. So next time a new variant emerges, you don't second guess their guidance.
You know, government buildings were constructed to command respect. After all, these columns are majestic. But the reality is that many Americans don't respect government these days. And while Congress and politicians are used to it, many government health agencies are not, like the CDC, which is why they're conducting a review to try and change that.
Over the last 2 years, you've heard a lot about the CDC, the nation's top authority on diseases and outbreaks. But you've also likely heard a lot of controversy about the agency, too.
It's just incorrect information.
First, there were public disagreements.
I really do think it's important to clarify this.
Major clarifications.
I want to discuss some of CDC's strategies.
And at times, confusing guidance in both the Biden and Trump administrations. At one point this year, the American Medical Association sent out this press release saying the CDC's guidance is confusing. While the CDC has been instrumental in increasing testing and administering vaccines, the agency has lost some public trust along the way. According to recent polling, before the pandemic, 69% of Americans believed what they heard from the CDC. Now, that has fallen to 44%. Recently, the agency acknowledged change is needed. On April 11th, the CDC began a one-month structural review to see what can be done differently. Jim McCrae, who previously held senior roles in public health for the federal government, is leading the effort. It will conclude early next month, and that is when the agency will begin to consider implementing changes to how they operate.
I spent most of my career working for the CDC.
Dr. John Andrus is a leading researcher and epidemiologist. He says one of the most needed changes is figuring out a way to make public health less political.
CDC should be protected as a scientific agency, so science is not politicized.
Another change, figure out a way to get local health departments to listen more closely to what the CDC advises. Again, the pandemic showed just how powerful local public health agencies are and how some are willing to ignore the CDC's advice.
It's not enough for an expert to stand up and say, this is what needs to be done.
In Washington, I'm Joe St. George.